It's time for an all-new Power in Politics, and tonight CBS 6's Tom Eschen sits down with former director of the National Institutes of Health, Dr. Elias Zerhouni, who worked for the Bush administration. He recently penned a memoir, Disease Knows No Politics. They discuss his time leading the department, the pandemic, and the environment today. Here's a portion of their conversation.
Hi, I'm Tom Eschen, and this is Power in Politics. Tonight we sit down with Dr. Elias Zerhouni. He's the former NIH director with the George Bush administration. Also just authored a new memoir called Disease Knows No Politics, talking about his origins and how he came from Algeria to America. We'll begin our conversation with a question about politics intersecting with health. We are joined today by the former NIH director in the Bush administration, Dr. Elias Zerhouni. Dr. Zerhouni, we really appreciate your time. You come on as the author of this new memoir, Disease Knows No Politics, certainly timely right now. Thanks so much for taking the time today.
Well, thank you, Tom, for having me. Appreciate it.
Yeah, of course. Let's start at that title of the memoir itself, Disease Knows No Politics. Why not, in terms of your perspective?
Well, the reason I use this title is because it was my experience when I was the NIH director. There was a huge controversy about stem cell research and other areas of research that people infused politics in it. And I testified in Congress. I said, look, in my confirmation hearing, I said, I'm coming at this from a stance of above politics. Disease knows no politics. Disease will affect you no matter whether you're a Republican or a Democrat. I wanted to send this message because I thought there was the need to truly focus on the fact that politically motivated, ideologically motivated things tended to generally produce negative results for the people. And so that was my creed, was my motto, if you will, all throughout my tenure, both at Johns Hopkins as well as NIH and later. And that's what it was. And we had experienced that. I don't know if you remember the HIV AIDS crisis. You know, people were saying, well, it affects gay people. Too bad for them, you know? And that I thought was wrong because at the time when I was at Johns Hopkins, half of the hospital beds were filled with patients suffering from HIV/AIDS. And thanks God, Ronald Reagan was really prescient enough to understand that this was a public health issue and allowed the funding of research at NIH, which came up with the first drugs. And today, look at HIV/AIDS. I mean, it's a controlled disease that does not lower your life expectancy and you can manage it. It's the same thing when you go across the spectrum. Whenever you have politics that becomes involved in choosing and picking the winners and losers in science, it doesn't bode well. It doesn't work.
Yeah, and you say that, and you know, you might hear that amongst officials. You might hear someone say, I'm very bipartisan, I don't like to get involved in that, or what have you. For you, why does that ring so true? What about you? And obviously the book gets into where you came from and your background. Why do you think that you're able to live that out? Disease knows no politics and not be political. What about you makes that happen?
Because I'm a physician. That's the reason. You know, I deal with patients. I did with people suffering. You know, I treated patients when I was at Johns Hopkins, and you would see those CT scans and the images, and you would see this disease state, and then you turn around and you say, what can we do? Well, nothing. We didn't have treatments for rare diseases at the time. And you can see these children, you know, who looked at you. I mean, I used to show the scans to the parents, and the child would be there, and the child would look at me. Not the images. Look at me and try to understand really what the truth was. And you would always say nice things and so on and so forth. So that's what told me, look, no disease should be off limits medical research because it affects people at the end.
You know,
that's the reason.
We were just talking about, you know, when you take this role coming off of Johns Hopkins and you have all of these different institutions, people pulling at you. And I think that was most relevant when, on your nomination, George Bush sort of thrusts the politics upon you and says, you both align with stem cell research. What was that like when you write this book years later, but also trying to live out no politics when the president's saying, well, we think the same way about this?
I think we had an understanding. I mean, it was clear to me that the decision he made to fund stem cell research on embryos that had already been destroyed, he made a Solomonic decision that pleased no one. People who wanted everything were unhappy. People who wanted nothing were unhappy. I thought it was a really great decision because for the first time, this research will be funded and we will understand something about it. And sure enough, 4 years later, the Nobel Prize was given to Dr. Yamanaka, who had studied in the U.S. and done his work in the U.S. and then went back to Kyoto. And he found the way. We understood how these cells get programmed and reprogrammed. So we never thought that we would not be in a position where we would not have to use human stem cells. That is the reason why I always believe that knowledge will tell us ways that I think align with ethics. But no knowledge will leave us prisoners of our own prejudices. And that will hurt people, will hurt children, it will hurt patients, humans. And that's where I come from. It's a doctor thing, first do no harm.
Well, you can see more of this conversation Friday night at 10:30 on the CW15 and on Saturday at 11:30 right here on CBS 6. The full podcast will be available Friday morning at 5 a.m. And don't forget, you can listen to our Power and Politics podcast every week. Scan the QR code on your screen and listen wherever you get your podcasts.